Well, I didn't have much of a choice. When I was a kid, I had terrible handwriting, so just about every teacher I ever had told me that I, was probably going to be a doctor. So that's just kind of the path I followed. I did one thing led to another, and next thing you know, I'm a physician, then a surgeon, and my handwriting hasn't gotten a whole lot better since then. I became a plastic surgeon because I liked a lot of things in different surgical specialties, but I didn't like any one in particular. I kind of ended my year, liking general surgery, liking ENT, liking orthopedics, liking urology. And I didn't know what to do with it. And my chief resident at the time was going to go into plastic surgery, and he said, maybe you should think about plastics. And so we didn't have a plastic surgery program at the University of Iowa at the time, so I spent a month at Northwestern. And I worked with some of the kind of big names in plastic surgery at the time, and I really, really liked it. It was like the light went on. That's what I wanted to do. There's a lot of things that make plastic surgery special, and because I do a lot of things, I get to see a lot of different things that get better. I mean, it's nice that way. I get to do a lot of good things for a lot of people. So better. What I mean by that, better than I was. We all in this world improve and continue improving as we go along, and if we don't, we're probably doing something wrong. There's a lot of people out there who can do what I do, right? But I hope that the people get an understanding of what we're doing and why, and understand that, because I think it's really important when they realize those things, that there's more to it than just, I'm going to have this done or I'm going to have that done. It's like, well, what's your decision-making process, and why did you do it that way, or do this instead of that? And I think it's important to help people go through that process of what you're doing, rather than just kind of like going from point A to point B.